I'm Dr. Michael Theodulou, a podiatric surgeon at Cambridge Health Alliance in Boston, Massachusetts, and I'm here with one of my patients, Bill. Bill is a diabetic who has been suffering from an ulcer on his left foot. Can you tell me a little bit about the history of this ulcer?
I'm diabetic, and I developed an ulcer on the bottom of my foot, which was a blister at first, and because of my neuropathy, I have neuropathy in my feet, I didn't feel it right away, so it was a little while before I realized it, and at that point, it had grown pretty large. It got to the point where I couldn't walk. I was homebound, and it was tough for me to get around, a lot of pain, and it wasn't healing at all. If anything, it was getting bigger. And we tried a bunch of different things. We had a visiting nurse come in every other day because I couldn't get out of the house really, and they would change the dressings and attend the wound. And it was going on for weeks and weeks and weeks, and it wasn't healing. The infection got better, but the wound itself wasn't healing properly. Dr. Theodulou, you came up with the idea of using this walking cast, and since then, I mean, I'm able to get around. I can do, regular things again, get in my car and drive to an appointment. Get about, the pain seems to have lessened. And more than anything, the better part is that it's healing. Every week I come weekly, and when you change the cast, it's shrinking little by little, the measurements, and it seems to be getting better. Makes things easier.
How having this total contact cast on has affected you, and has it made life easier and your quality of life?
Absolutely. It's been outstanding. I have a torn Achilles also, which is, not allowing it to, a lot of weight is going on it. But since the cast has been on there, I feel like the pressure is coming off it. I'm allowed to walk around and not as much pain. And the best of all is when I come every week and they remove it, it's been shrinking. So the wound is finally actually healing because of the cast. So I feel a lot better.
So there's a certain comfort level in knowing that you are doing something right and getting this wound to heal, but it still hasn't stopped you from living a life.
Actually, this cast gave me back my life. Just the fact that I can leave the house, but even in the house, because I'm diabetic, getting to the kitchen was a hard thing. Getting to the men's room was a hard thing, which, I'm diabetic, I go a lot. With this cast, it allows me to do that stuff that I couldn't do. I have 4 children, and, I need to drive my car. And this allows me to go out in everyday life and do things I have to do and get things done. And this foot, it just wasn't healing at all until we started this cast.
What was your experiences so far in our clinic with regards to taking off one of these casts and reapplying one?
I'm amazed. I coached football for 25 years, so I've had casts put on and off, not only me, but my players for years. And this is incredible how fast they get this off and get it back on. When they first told me they were going to be doing it weekly, I'm saying to myself, my life is going to be in the hospital. I'm going to be here all the time. But it's amazing. I come in here and they have it off and the new one on, and it's just incredible, the speed that they work with this.
Is there anything you would like to tell other patients who may have similar wounds or problems that may be getting frustrated that they're not seeing the wound healing in a timely fashion with regards to maybe utilizing some type of treatment like this?
You don't have to live with pain when you have an ulcer. And I really was in a lot of pain the first 7 weeks. The throbbing and the burning sensation, it goes away with this. I'm allowed to walk, and at the end of the night, I put my feet up. I don't have to sit there in pain with tears in my eyes. This has been incredible as far as making it comfortable for me to live while it's healing. And I advise it for anybody. It's outstanding so far.
I want to thank my patient Bill for spending some time and discussing on an intimate basis the challenges that diabetics face when they're dealing with an ulceration. And I wanted to point out that besides the use of the Cutimed total contact cast offloader, ancillary treatments were also done and modified. When Bill came to see me, he was utilizing a silver impregnated hydrofiber dressing that we elected to go ahead and change and utilize the Cutimed Sorbact because we thought this would produce a more physiologic healing bed and limit the toxicity of the epithelial cells that sometimes silver can afford and impact the ability to heal this wound as well.